Alberta doctors and those representing healthcare workers in the province are still sounding the alarm over emergency room wait times, saying promised relief in the form of emergency room triage doctors still hasn't come. The focus on long wait times comes in the wake of the death of a 44-year-old Edmonton father at the Grey Nuns Hospital in southeast Edmonton late last year. He died of suspected heart attack after waiting 8 hours in the Grey Nuns ER.
But, maybe get some labs started, order some x-rays. Someone comes in, obviously has a fracture. You want to get that x-ray done sooner rather than later, just to try and speed things up so that when patients get into the department itself, when a stretcher opens up, some of that work has already begun.
The president of the group representing physicians in Alberta says triage doctors do make sense. While the province promised they would start this month, but so far no meetings have been made and there are no contracts.
What needs to be in a contract, iron out the details of, any outstanding financial components to it. If they were able to have that meeting, negotiate, little give and take, I think it probably would happen. I'm not hearing from government that there's a desire to have that.
The province not saying if any triage doctors have started or giving a timeline on when they would start, just that they are actively recruiting, with the first triage doctors going to the Grey Nuns and University of Alberta Hospital in Edmonton, as well as the Foothills Medical Centre, Peter Lougheed Centre, and South Health Campus hospitals in Calgary. It comes as the same time the union representing Alberta's healthcare workers says over 25,000 people have signed a petition calling for a state of emergency over emergency room wait times, collecting over 8,000 stories of Albertans suffering through long wait times to get emergency care.
Perhaps using, the Alberta's Public Health Act would allow the government to centralize some decision-making quickly, centralizing emergency funding and implementing some of the temporary emergency staffing measures.
But the Premier admits more work needs to be done.
On the first point of access people have going into emergency room, and making sure that emergency treatment beds aren't filled with patients waiting to get a bed on a higher floor.
But says to expect more news on hospitals next week. Darcy Ropjan, City News, Edmonton.